One of the biggest myths that I see around menopause in general is just the fact that it is the end of your sex life.
Look at your sexual script and see, like, what have we been doing and what do we want to do differently? Maybe you've been having shitty sex your whole life.
Hello, everyone. This is Sex Positivity Unfiltered, where we talk about sex and we are not polite about it. My name is Lyndsey Murray.
And I'm Denise Stratton.
And today we have a very special guest, Brandie Sellers, here, who is going to talk to us today about menopause and sex. And so just to give a quick introduction for Brandie, Brandie Sellers is a licensed professional counselor and an ASEX certified sex therapist. Brandie practices counseling via telehealth in Texas, Colorado, and Vermont. She specializes in sexuality, trauma and EMDR, and illness. A two-time breast cancer survivor, Brandie has written for cancerwise.org and speaks to cancer survivors, counselors, and other professionals about cancer survivorship. In addition to counseling, Brandie has taught yoga and meditation since 2005 and is a certified yoga teacher at the 500-hour level. Brandie recently added ketamine-assisted psychotherapy to her practice and has seen personally and professionally the power of psychedelics for emotional healing. Brandie's motto is that we did not come here just to suffer and then die. We all deserve pleasure. As a side note for our listeners, Brandie is a personal friend of mine, someone I would consider one of my best friends, and not only friends, but we work very closely together. And we also have another podcast called Real Therapy Gone Wrong. So that's just another little side project that I personally have with Brandie. And so anyways, we're just really excited to have you on today.
Thanks
For
for
being
having
here.
me.
So the topic we're talking about, sex and menopause, I think is really important. And I was really glad when you mentioned it to me. And I think we both were like, excellent, because this is a topic I don't even think we really know that much about. So I know that not only will you be helping our listeners with this topic, you'll be helping us too. So I know we're going to walk away learning something. So just to get us started, I mean, the first question really for us and our listeners is, what exactly is menopause and how does it affect women, their sexual desire, arousal, kind of all of the above?
Yeah, it is a mystery, isn't it? Like, and what you said about how y'all don't know about it, because so I'm 51 and y'all are a lot younger than that. And the reason why none of us know about it and it feels like such a mystery is because we have no community around it and no one talks about it.
Yeah.
And, even if you think about the words that we use as euphemisms for menopause, like the change, or which feels like very mysterious. I've heard like the decline of life, which
Oh
is
my
very
Jesus.
depressing,
That's
right?
so like morbid and terrible. Yeah.
Right? Private summer is one. Like some of them are centered around like hot flashes and the fact that you're hot. But menopause is actually, we all use the word, or most of us are using it wrong. So, menopause is the 1 year anniversary of your last period.
Okay.
So, perimenopause is the like up to 10 to 14 years prior to the anniversary of your last period. So, perimenopause is actually the time when people start to experience a lot of symptoms. So, that can honestly be like from 35, from the age of 35. And because we don't talk about it, we don't even know. Like, we might be experiencing, like, oh, my joints are achier or ear itching. A lot of women in perimenopause get itchy ears. But
Oh,
yeah, right? And other, like we might get drier vaginas, but because we don't even know what perimenopause is, we start to think we're crazy that we're having like all these health problems all of a sudden, that we're just falling apart and we're crazy.
yeah.
And and because we parse out our bodies by different doctors, it might not get caught that way either, right? Like you might be going to the ear doctor because your ears itch, and you might be going to a rheumatologist because you got joint problems. And nobody might be like, oh, let's look at this person as a whole, and these might be perimenopause symptoms. So, perimenopause is the time when we start to lose estrogen and progesterone. And that is what puts our body into eventually not having periods. And also that shift, like puberty in our teens, causes a lot of wreaks havoc on our bodies.
I did not know any of that.
See,
I'm a little mind blown right now.
Yeah, so I'm about to be 35 here. So I'm
Same, same. Yeah, my next birthday, I'll be 35.
So I'm curious now, what would be some of the symptoms that I should look out for that most people would think are, oh, that's just you getting older and that happens to every, their joints always hurt. It's okay.
right. Yeah, so it's actually a pretty long list, and like I do have a list and I'm going to tell it to you, but it is not exhaustive.
Okay.
Joint problems, which is partially so progesterone is what causes us to just like be lovely lubricated people, which if you think about all the places you have lubrication, ears, nose, eyes, joints, vaginas, like anywhere that is like lubricated or snotty or like that can be reduced. So you could get dry eyes, you could get itchy ears, you could have a dry vagina. Your joints have less fluid. And that's because of the lowering of hormones. That's what causes that.
Mm.
Skin changes. Also, that's a dryness issue, right? So our skin can get thinner and drier. We might need more lotion. I used to tell my grandmother when I was little that she had chicken skin. And now that I'm 51, I also have chicken skin because I can look at my skin and be like, oh, that does really look like chicken skin.
Okay.
BO, a lot of women in perimenopause say that they are stinkier like when they were teenagers. So if you're all of a
Oh.
sudden, if you like never had BO and all of a sudden you're like, damn, what is going on? Then that could be a symptom of perimenopause. Restless legs. You might discover you have twitchy, restless legs. Brain fog. So a lot of people like this is if you could always remember things great and then all of a sudden you can't, the first thing you think is, "Oh my god, do I have early onset dementia? Like what is going on with me?" Right?
Yeah.
Oh, okay.
And so of course we should go to the doctor if we're experiencing like any kind of new symptom, we should go to the doctor. And it's probably not dementia, you're probably not crazy, you probably are in perimenopause, and that is why all of a sudden you have brain fog. Bloating can be a symptom of perimenopause because just like if you're going to get your period, you might bloat, like any hormonal fluctuations
Yeah.
can cause bloating. Um, Gaining belly fat. This is something that like a lot of people experience and we get mad about it. But if your ovaries are producing less estrogen, and your body needs estrogen for your bones and your heart health, then your body is brilliant in that it gives you more fat because fat has estrogen in it. So your body's like, okay, cool, cool. We're not going to be getting this from our ovaries anymore. So we need to get a little fatter so that we can still get the estrogen that we need to like run our whole bodies and be healthy, which I think is interesting, right? Because what would we do is we would try to go on a diet. Like
Yeah.
Yep.
so many women are at risk for eating disorders in perimenopause because of this just natural body change that
Well, and they
happens.
also, women, and I'm guilty of this too, blame themselves like, oh, I must be eating too much lately, or
Yes.
I must just be not exercising enough. Like I'm being lazy.
Yeah.
There's all, right. Like you just have that narrative of, well, this is my fault, clearly, when
Correct.
really your body's looking out for you.
Correct. And also, if you were a person who could just like, have some sort of like disordered eating something or other for 3 weeks and lose weight, that's not going to work anymore. So then that's
Yeah.
another like, oh, something really is wrong with me because in the past I could just, intermittent fast for 3 weeks and be fine or whatever. And
Yeah.
now that doesn't work anymore because guess what? When your hormones change, your body does not work the same.
Wow.
Mhm.
I can see why you would. I mean, I've not known any of this until this point in time, but a lot of this does just sound like you're on your period, you're getting
Yeah.
older, your metabolism's slower. There's all those like typical reasons you hear,
Yeah.
but it could be this.
Right.
Oh, man, look at
Um,
us getting a medical listen right now.
Yeah,
we're only
seriously.
halfway done with my list also. I do want to be clear though, like not everyone gets all of these things, right?
Okay.
And
Yeah.
some women are lucky enough that they get a very few of these things and have like a relatively easy period of perimenopause. So it's not like we're all doomed to get all of these things and it's terrible forever. And the other thing I want to make clear is that once you hit menopause, some of these things will get better, right? Like
Yeah.
your libido will get better, possibly. We're going to talk about libido in a minute, but it's not like you're just destined to suffer until you die.
Mm-hmm.
That's not it. It's just this time, just like in puberty, where it's like intensely, for some of us, if we have intense symptoms because we're having this intense change in our hormones, which eventually will just level out. Sleep problems, a lot of women in perimenopause have sleep problems. And part of that is hot flashes. Part of that could be restless legs. I mean, any of these other things, if you're bloated, maybe you have sleep problems. If your
Yeah.
ears are itchy, maybe you have sleep, so it kind of goes together. But a lot of women have sleep problems. And a lot of that is hot flashes. And not every woman experiences hot flashes in perimenopause, or every person assigned female at birth, because trans men could experience menopause also.
Mm-hmm.
But hot flashes are definitely something that a lot of people seem to associate with perimenopause.
Okay.
And it does feel, like if you go outside in summer and you're like, damn, it's hot out here, hot flashes literally like start from the inside and radiate out. It's like, all of a sudden you're in an oven or something. It is a
Mm-hmm.
totally different experience from like being hot from external sources. It's like you've created this heat situation and you're sweating profusely all of a sudden, even though 1 minute ago you were cold, or
Mm-hmm.
it's very different. Hair changes. A lot of women get thinning hair in menopause, or like thinner hair, vertigo. We talked about dry eye, migraines, bladder issues. So one thing I didn't know until I started really digging into this is that UTI are a huge cause of hospitalization and even death for older women. And part of the reason for that is lack of estrogen around, like in your vagina, basically, like lack of systemic estrogen. And if you don't have, if you're not using vaginal estrogen, it can really cause more UTIs. So bladder problems, like more frequent peeing, and like when you're pregnant, only you're not pregnant, it's menopause. And then irregular periods. So some women don't experience irregular periods and just stop menstruating, and 1 year later menopause, that's it. Some women experience like more frequent periods, and they could be like, oh, my period lasted 1 hour. It could be like, oh my god, there was a mafia hit in my bathroom. Like they really vary widely.
Well, and
um,
there's also like it's also very complex because like I have PCOS. And so
yes.
until I got treated for that, my cycle could be like 60 days long. I might not have a period for a while, or I might have like two in 1 month. Or I mean, like even that is like even around my age, you know what I mean?
Yeah,
Like
for sure.
what is really going on can be so hard to pinpoint.
Yeah, and because you have PCOS, then I think PCOS is one of the causes of earlier perimenopause, if I
Yeah.
am remembering correctly.
Yeah, I would believe that because it's like it's a hormone imbalance. So
Right.
it makes total
Well,
sense.
and there are things that can affect, like there are non-normative events. Like I went through menopause or perimenopause at 37 because of cancer treatment. So I was going along. I don't think I was in perimenopause at all. I was really loving having all of my estrogen and progesterone and all that stuff.
Hmm.
And then with the chemotherapy that I had, makes you immediately stop menstruating. And so I was like bald and nauseous and also having hot flashes, and like my sheets would be soaked every night, and having all of these, not all these, but a lot of these menopause symptoms in addition to doing chemotherapy. And then because I have estrogen positive cancer, I can't take hormone replacement therapy. I cannot have estrogen,
Hmm.
and I had my ovaries out. So that's a non-normative life event, but a lot of AFAB people have non-normative reasons to experience hormonal fluctuations. Like trans men would possibly, if they're doing cross hormones, then they might have a period of hormone fluctuation when they start taking testosterone. That could cause some of these symptoms. Men with prostate cancer oftentimes have to take a hormone blocker, and they experience sometimes some of these menopause symptoms like hot flashes and other things. So
Yeah.
it's not just AFAB cisgender women who can experience this. And it's also not that it's only women who are in these age groups that we talked about.
Hmm. Yeah,
So,
absolutely.
yeah.
So that makes me a little curious. And if you don't want to share your experience, totally fine, no problem at all. But I'm wondering what what symptoms did you have that you didn't associate as perimenopausal symptoms? And how did you, like, was it a doctor who told you that, no, this is it, sorry, you're perimenopause?
Well, it is kind of hard to parse out at the beginning because I also was doing chemotherapy. And
Yeah.
so it's really hard to say, you know, I was having like joint problems and neuropathy and other things, but those are also side effects of chemotherapy. One thing I can say, because that was 13 years ago, one thing I can say is, and we didn't talk about this yet, but a lot of women in perimenopause or menopause are getting diagnosed with ADHD or autism. And it's not that they weren't autistic or didn't have ADHD before, it's just that maybe they needed less supports. And because these hormonal changes are happening, these supports or systems that they used before, their coping mechanisms that they used before, are no longer working. Because it's like if you've got, you know, if you're just like working, suggest if you're working and raising kids, you might have like your life sort of figured out, like, okay, I can do this. But then you start getting all of these other symptoms or other things might start happening, and it closes your window of tolerance more. And then you don't have access maybe to as many coping skills for being neurodivergent as you had before. So that was me. Like I got diagnosed with ADHD after treatment because I was all of a sudden like, why can't I show up on time to things? Why can't I remember? I can't focus to get a task done and these types of things. So for me, that is something that was a really big change. For sure, vaginal dryness, and most people in menopause are going to experience vaginal dryness. And that is something that isn't like if you get that in perimenopause, that isn't probably going to get better. But you can use vaginal estrogen, which is very inexpensive. It's like $35 for 2 months worth. You use it twice a week. You can get it in a cream or a little pill, and the pill has a little applicator shooter thing because you
Mhm.
shoot it in your vagina. You don't take it orally. And there's a lot of research that shows that even people with estrogen positive cancer can use it, like I use it.
Oh, wow.
And it really helps to, it makes you lubricate, not just like when you're turned on, but just like as a human.
Yeah.
Um, because if you're dry down there, even walking can be painful. Because if you think about it, like your vagina is like
It's
two
like
sides.
friction. Yeah.
Yes, can be rubbing together. And so even just sitting, standing, walking can be painful. So vaginal estrogen is a great solution for that. And I really encourage anyone who's experiencing dryness, and you don't even have to be like in menopause. You don't have to reach the 1 year anniversary of not having a period in order to start using vaginal estrogen either.
Okay.
Is this provided over the counter, or is it something that would have to get prescribed, or?
That is a great question. It is done by prescription, and you can ask your GYN about it, your gynecologist, and also another professional that I feel like as a woman, I was really clueless about until a few years ago, and that is urology. I always thought urologists just handled penises. I don't know why I thought that. I just,
That's what I thought for a long time too. Like even in the
right?
work we do, I feel like, when we see like men with erectile dysfunction, let's say, that's where I always hear urologist, urologist, urologist. So it's easy to associate it with that's all they do.
Yeah, right.
Mm-hmm.
But urologists also deal with sexual health issues
Yeah.
for people who are assigned female at birth,
Mm-hmm.
not just men. And so there's one on Instagram, Dr. Rachel Rubin is her name. And I'll send you the link, Lindsay, you can put it in the show notes.
Okay, good.
And like vaginal estrogen is the hill that she will die on. Like she's lobbying the FDA to remove the black box warning. She makes a lot of content about it. She posts studies, so she's not just like a quack Instagram doctor, but I've learned a lot from her about this issue and just the importance of it. And it's so affordable, and there is just not a reason that the vast majority of women couldn't be using it. And if you do ask your doctor about it and they poo-poo it, you should definitely make your doctor tell you very exactly why that is. And if you aren't happy with that answer, get a second opinion
Mm-hmm.
for sure.
Yeah. Is there any, aside from vaginal estrogen, is there any lubricant that you advise for people? Like whether it's to have sex or not? I mean, I don't know.
Lubricants, like just use some.
Yeah.
Depending on depending on the toy, like if you're going to engage with toys, if you have a silicone toy, then you need to use a water-based or oil-based
Yeah.
lubricant. If you are having like penis vagina sex or really any sex that isn't involving a toy or a condom, silicone lubricant I think is the best lubricant just because it lasts a long time. It's very slippery. Silicone lubricants like Uberlube are super body friendly and can be really great. There are some lubricants that are coming out now for like specifically marketed to women in perimenopause and menopause. And I think it's fine to try those, but whenever I see products that are marketed towards really any certain group, I'm always a little leery about like who's profiting from this? Is this bullshit? Because there are also a ton of vitamins and things like that. And those
Yeah.
things aren't FDA approved. So like maybe they're helpful. I don't know. But maybe they're just giving you expensive pee and not something to spend your energy on. So as far as lubricants go, like if you want to try those ones that are geared towards women in perimenopause, great. If they work for you, great. And also I think really any lubricant that matches your sexual activities and whatever sexual aids you're using is great as long as your body is happy with it.
Okay.
Okay.
Yeah.
Awesome. Now I want to really, really shift into sex because
Yeah.
we've already started with the lubricant. So, I
Yeah,
mean,
let's do
perfect
it.
segue.
Do
So,
it.
one of the biggest myths that I see around menopause in general is just the fact that it is the end of your sex life. Is that true? And if it's not, what are ways that people who, because I do know that the libido does go down, or ways people can counteract that?
Well, it's for some people it does. I mean, that is true. For a lot of people it does go down. It doesn't, that's not universal either.
Okay.
And also, I think it's so important. And this is an area where I feel like maybe in 20 years we'll be able to speak to this better because hope to God people will be researching this more.
Yeah.
But I mean, if you are all of a sudden like maybe a little rageful, because rage is definitely a symptom of menopause, like anger. It's like you spent your whole life perhaps doing all the things as an assigned female at birth person that you're quote supposed to do.
Mhm.
And then you kind of get to this time where you have less estrogen and you're like, wait a minute, what about me? And then you start to kind of maybe get angry about, I don't know, all the things. And so if you are in that place where you wake up and you look at your partner and you're like, why the fuck am I even married to you? Well, then you're not going to want to fuck
Okay.
them, right?
Yeah.
So
Okay.
that can make your libido go down. Also, are you maybe gay and you didn't know it? And now you're figuring that out. And if you, or I mean, maybe you're straight and you didn't know it and you're in a gay relationship. I don't know. I doubt that would be happening as much. But maybe you're a lesbian and you don't know that till you're 50 and your libido might be down because you're married to a man and you're like, ugh, I don't like that. Maybe you've been having shitty sex your whole life. And if you've been having sex not worth having, and you're kind of at a point where you're like, I'm not doing things I don't want to do anymore, then you might be like, well, I guess I'm not having sex anymore because that sucks. So I think we have to look at all of those reasons we might be having a lower libido, and it's not necessarily because our hormones have changed, although it can be also.
But it kind of goes back to what you were saying earlier about like people that might be diagnosed like as neurodivergent, like after going through this period because like their coping skills are no longer working because now they're going through X, Y, and Z. It's kind of
Right.
like that. It's like your body's going through this huge change, and maybe there's a lot of realization to be had in that. Like, oh, whatever ways I was pushing through before, I don't really want to do anymore, or I can't do
Yes.
anymore. And so maybe I'm realizing like this just isn't working for me. And that's a really important distinction with low libido versus like outside factors. Cause like in our work, like I think we hear that often, like, oh, my libido's low. I don't really like that. Sometimes it is just hormonal or they're depressed or there's like factors like that that play a part. But sometimes when you inquire more, the libido's there. It's just maybe they don't want to go there with their partner for like various reasons. So that is like an important distinction to make, right? Of like
For sure.
what's going
They're
on
like,
there.
well, we only have sex once every 3 months. I'm not that horny. How often do you masturbate? 7 times a week. Like, okay.
Right. Yeah,
Yeah.
exactly.
So, and some of the things like vaginal estrogen can help with that. Because if you think about it, like as people who are assigned female at birth and have mm, vaginas, then like when we associate being lubricated with being sexually excited sometimes, right? So if you're using something that can create more lubrication, then that also can be like, oh, like it's a little juicy down there. That can be exciting, right?
Mm-hmm.
Some people are able to use hormone replacement therapy that is systemic, like with a patch or a cream that you can use it. That's also prescribed by your doctor. And there, for a while, women were using it, and then they, in I think the 80s or 90s, I can't remember, there were some concern that it caused heart problems. So then doctors were limiting the number of years that women could use it. Not all women could access it. And now they know that that isn't true. And that for a lot of women, you can take it till you die if you want to. So that's another thing that people can talk to their doctors about. And that can help if it is like a hormonal reason for lack of libido. But also, you might settle in once you're done with all of this fluctuation, then your libido could return because of that as well.
Mm.
You know, let's say you're in a great relationship and your partner is really understanding about all of these menopause symptoms, and then that can create more closeness. And also, it's a chance to look at your sexual script and see, like, what have we been doing and what do we want to do differently that, and maybe we want to try some BDSM, or maybe we want to be poly, or maybe I don't fucking like penetration anymore. So what else could we do? You know, like just looking at other ways that we can engage sexually can also, because that invites novelty and that's sexy.
Yeah. So
Yeah.
really, so that, you know, that, I mean, really what you're saying is I like that term sexual script.
Me
Because,
too.
yeah.
That was
Yeah.
good.
Because we all have one. We
Yeah.
don't, we don't always like sit and write it down, but we've got one
Right.
in our head. And then if that is no longer working because of like all these external factors, you could just make a new script.
I like that.
Yes.
I
Yeah.
like that. Yeah.
And that is morally neutral. Like I feel like we also have this idea, especially if we're in like a male-female relationship, we have this idea that like even if we think about what the definition of sex is, if you ask a straight couple, sex is like penis vagina intercourse,
Yes.
right?
Yeah.
If you ask a lesbian couple or a gay couple, you're going to get different answers because they probably are going to have a wider. Denise, you think that's true? Yeah.
Oh yeah,
Yeah,
100%.
because
Which
there's no
I
penis.
which I love. Like
Yeah.
you're absolutely right about straight couples. I mean, I'm even thinking about work. I think it's like a daily occurrence where I have to ask, like someone's like, "Oh, we haven't had sex in a while." I have to ask, "Are we talking about sex or are we talking about intercourse?"
Right.
Right?
Yes.
Because there's a difference. And a lot of
Yes.
people just kind of interchange the two.
Yep.
Yeah. And there are lots of reasons if there is a penis involved that we might have to change our script. Like
Yeah.
cancer treatment for men. Sometimes then their penis doesn't work the way that they want it to. So we got to change our script up about that. And
Mhm.
it's all just it's all okay. It's all morally neutral. It's
Yeah.
okay. We can embrace learning different ways to experience pleasure with each other regardless of whatever body parts we have. And I think that helps libido if we think about it in those terms. Like, oh, my life isn't over. Like, I'm never having sex again. No, we can do all sorts of different things that we could call sex.
Well,
Yeah.
shifting the script has a lot to do with shifting your mindset on what sex is for, right? So when we're
Yeah.
younger and we're teaching people or kids about sex education, it's never really about a pleasure-based sexual education. It's all about procreation, right? It's all usually reproductive history. Yeah. So a lot of people go throughout their entire life thinking that sex is more about getting kids
Yeah.
than it is about anything else. And whenever you hear the term menopause and you hear the change, a lot of times the change, or at least in my mind, was always, okay, so this is the time where now sex isn't about having kids, right? You don't have that, and for the queers, that heterosexual scare of pregnancy, right?
Right.
So now you can have sex without having, pregnancy scare. But after, I feel like that might be the reason it widens your definition of sex, because now it's no longer just in order to start a family. Now it's, hey, what can it do for me? How can I get off, or who can I be now?
Which
Yeah.
in a way, I mean, I'm kind of like flipping this on its head, because I think people really get down in the dumps about like going through perimenopause or hitting that 1 year anniversary of not having a period. I'm kind of flipping it on its head, because in a way, this can really end up being kind of an exciting time for your sex life, because like, let's say you were having mediocre sex this whole time. Let's say, like, for a straight couple, sex has been penis and vagina sex. It's pretty typical. That's what they've always done. If that option is no longer there for a period of time or forever or whatever, like, it's kind of exciting to be like, we need to switch things up, and maybe the switch up will be way better than what we've done in the past 10 years or 20 years or whatever. So it's kind of
Absolutely.
exciting in a way.
Absolutely. Also, I want to make clear that lots of people have penis vagina sex after menopause, and it's fine.
Yeah.
So
Hey.
I don't think we should say like that's over either, but I
Yeah.
do think that we might want to change it. And some women do experience pelvic pain with
Mhm.
menopause, but a lot of times it's because of dryness. This is why like lube and some lube and some lube is
Mhm.
really important, because you cannot fuck with a dry vagina and have that be a pleasurable experience.
No.
Period. End of story.
Mm-mm.
Okay, that
And
makes
no one
sense.
should ever push through pain either.
Right.
I'm
Yes.
really big on that. That's another thing I hear too. Like, well, it kind of hurts. I'm pushing through. We shouldn't be doing that. If there's a resolution to that, great. Let's explore that. For the time being, what else can you do that would just feel way better
Yeah.
for both of you?
Why white knuckle through something whenever you don't have
Right.
to? Yeah.
Yeah, absolutely.
Yeah. No, we're not doing that anymore. Mm-mm.
So that myth of, your sex life is gone after menopause, you disagree. Would you also say that it is possible to have better sex after
Yeah,
menopause? Yeah. Okay, good. That's
I
awesome.
think so. I do think also, though, there's like in my young cancer community, there's a lot of the saying, use it or lose it. And so the more that we masturbate or engage sexually with a partner, then the more, because if you think about it, like when our vaginas get engorged, like blood is going to that area, right? And so that is like energizing and sustaining for that area of our body, for our pelvis, our that whole area. And so the more we masturbate or have sex, then the more things are happening down there and the more blood flow we have. If you have like a long period of not engaging sexually, then you're having less of that, even if it's just sexually with yourself. So I think that is one way that we can keep ourselves up, is that we could use it, and that will help our sex lives also. Think of it as like, well, you have to masturbate because it's therapy for your vagina. So you got to do it.
I like it. I like it. I mean,
Yeah.
that speaks to anything with the body. You
Yeah.
you want to work out more if you already have a routine and you enjoy going on long hikes or walks, or that's already part of
Yeah.
yeah, you enjoy it more, versus if you take those long breaks because something gets in the way, it's so much easier to keep that break going. Yeah,
Yeah,
Mm,
yeah,
for sure.
makes sense.
yeah.
Okay, yeah, cool.
How do you have any tips for our listeners as far as like communication with the partner?
Yes.
Like for someone who is going through this, how to communicate that on a sexual front, but even just kind of in general, to just talk about your experience with them.
Yeah, I think that hopefully we all have partners who, if we have partners, hopefully our partners will listen and understand that we're having this constellation of symptoms, whatever they may be for us, and what that means, and that they will have compassion and be there to help. Like, this is, anything with sex, if we're partnered, it's like an adventure we're having together. So, how could we work together to create the best adventure possible under these circumstances?
Yeah. Yeah, that's a really good way to put it. I think it's harder if someone had a partner that wasn't understanding and
Yeah.
kind of wanted to, speaking of the term sexual script, wanted to stick to the sexual script they've always had.
Yeah.
That rigidity makes it hard to create
Then
understanding and
then you could go see a sex therapist. And then also, this would be a good time to point out that a lot of women get divorced in perimenopause and menopause time periods or quit their jobs because a lot of women, it's like, it's not the decline of life, but it is like, okay, this may be like the final third of my life or whatever, at whatever age. The average age of menopause is 51. Like the average
Mhm.
age of the 1 year anniversary of your last period is 51. So if you're like, okay, I got like maybe 30 years left,
Mhm.
do I want to spend it with this fucker who won't talk to me about like having a new adventure sexually together? Maybe
Yeah.
not.
Yeah.
And if I the partner doesn't wanna go to therapy or doesn't wanna talk about it or engage in this and isn't compassionate about it, do you wanna spend 30 more years with someone like that? Like, is that what you want? I mean, if it is, okay, everybody can make their own choices. But for a lot of women, they decide, "No, that is not what I want." And so they can leave their partner.
Well, and that's why there's that saying that you like find out who people really are in difficult times, because when things are difficult and you have to adjust, and if someone isn't willing to do that, or I mean, there have been partners who have even been really harsh about it.
Yeah.
Like in what way?
Harsh just meaning I have seen partners pretty much blame their spouse for what they're going through. Like it's such an inconvenience to them that now they're just angry at their spouse all the time. But if, if your spouse is going through perimenopause or they hit menopause, that's not their fault. I mean, what can they do about it? I mean, they're going through what they're naturally going to go through. And so if a partner is really harsh about it and they make it about how it's just an inconvenience to them and they dig their heels in on that, to me, that feels really
Yeah.
harsh.
Yeah.
And so when you see that, that harshness might not have been there, or they might not have seen it like prior to this time. So, when you're going through a difficult time, like it's kind of it can show if someone is going to really be there for you or not, I guess is what I'm saying.
Yes, and also I think that goes back to the wider issue, and that is that we don't talk about menopause or perimenopause
Mhm.
because it involves women bleeding from their vaginas, and we don't talk about that. And it's sort of like a snake eating its tail because it's sort of like misogyny is the reason we don't talk about that. And then now, if you're with a partner that's mad that your spouse or partner is going through menopause, it's kind of your own fault because maybe you've participated in this sort of male dominated situation where we don't
Yeah.
talk about the fact that women bleed for a significant period of our lives. And then when that stops, it creates issues for
Yeah.
some people. And if we talked about that all more and normalized it, then I think people, especially men who are married or partnered with people assigned female at birth, would understand, would know, like, oh, this is a universal experience
Mhm.
that 50% of the population is going through or at some point will go through.
Yeah, and I just want to say too, like when I say like partners who can be harsh, I think when all these changes start, I can understand it if everything feels kind of shaken up, and I can understand having a maybe an initial negative reaction or a confused reaction
Sure.
or hurt feelings. Like I get all of that, and I think I'm coming from like my therapist hat on this. Like I try to leave space for all those feelings because I think that's important too. The
Sure.
harshness for me comes in when we reach a point of like trying to understand and educating and like, hey, here's what's really going on, and these are things out of their control. And someone still is like, but what about me and the sex that I want to have? Even if that sex is hurting my partner, but I still want to do it. Like if they're just stuck there,
Yeah.
that's where it gets really, I mean, and Brandie, as well, just from our line of work, like it gets really hard to know like what to do with that. Like I would imagine if you're going through perimenopause, yeah, what do you do with that?
Yeah.
And
Well,
that brings.
also,
Go
oh,
ahead.
sorry, go.
No, no,
I was
Brandy.
just gonna say that it also, because we don't talk about it, so when these things start to happen to us in perimenopause, as people who are experiencing it, we might think we're crazy. Like, and so that may be what we are conveying also to
Mm-hmm.
our partners. Like, what the fuck is wrong with me? I am losing my mind.
Yeah.
I don't understand what is happening. And sometimes that is reinforced by doctors, because a lot of people who go to the doctor because they feel like they're crazy are told, like, maybe you need antidepressants, or maybe you need anxiety medicine, or
Yeah.
maybe you're too fat, or, we're not given oftentimes helpful advice. And so I think the mental health aspect is also just really important to know about for us as people going through it, and also for our partners to understand that we can have,
Mm-hmm.
especially if we're not validated by doctors or our partners. I mean, if you think you're kind of going crazy, I hate using that word. If you think you're like really depressed or anxious and you go to the doctor and they are like, "Yep, that's what's going on," and your partner is like, "What's wrong with you? You're losing your mind." Of course, you're going to be like, "I am losing my mind."
Yeah. Yeah.
And then if you
Absolutely.
take Zoloft, guess what's going to happen? Your libido is going to go even more into the shitter than it might have already been, right? So
Yes.
then you're like doing things that are not helping.
Makes sense. Yeah. So, okay. So now, since I am sitting in the room with two experts who do see a lot of heterosexual couples, I'm curious, like, speak to the partner who doesn't know anything about menopause, who's never had any type of feminine health discussed in front of him
Yeah.
at all. Like,
Mm.
what advice would you give to these partners that are noticing maybe a change in in their wife and their partner? What, like, as therapists, what do you wish men knew?
I'll give you the first thing that comes to mind. This is maybe some like vague advice, but I always like to tell partners, you don't have to understand everything to validate the experience. That's always my go-to, because it is a confusing time, I think, for everyone involved. Like, your partner might be behaving differently because they're experiencing hormone fluctuations, or now they have this new pain that they didn't have before. Or maybe, I don't know, if y'all did some activity together and that activity is no longer available for your partner, that can be really hurt. Like, it can hurt, right? Like, hey, we had this shared thing that we don't have anymore. I mean, I always advise sharing, like, as the partner of someone who's going through like menopause. I think it's good to create a space where you can share that, not in a blaming way, but like, your experience matters too. And then, like I said a second ago, you don't have to understand all the things
Mhm.
to validate the experience, right? Because if you're not in those shoes, like, you can have empathy without having gone through the exact experience of someone else.
For sure.
Yeah.
And also, if you're the partner and you're lovely and you want to co-create this adventure, then you can educate yourself about
Mm-hmm.
perimenopause.
Mm-hmm.
I mean, there's a really good book by Heather Corinna called What Fresh Hell Is This? It's like, the subtitle is Perimenopause, Menopause, Other Indignities, and You. But it is a really accessibly written book that they wrote, and there's no reason why someone with a penis couldn't read that book, and or listen to a podcast about perimenopause and menopause, or find some other education about it, because that's what good partners do. Let me learn a little bit about this so that I can maybe understand what you're going through, and also not make it incumbent on the person who's experiencing perimenopause or menopause to come up with solutions either, because if we're co-creating an adventure, then both people need to be responsible for that.
Which is such a lovely thing to do as a partner for anything.
Yeah.
I mean, I think about like neurodivergent people, if they have like a neurotypical partners who research neurodivergency and what that means and what that could show up as, it always makes their partner feel so good.
Yeah, that's
Because
super sexy.
yeah, it's extremely sexy, and also shows that they care and they're willing to go out of their way for you. And that is such an excellent piece of advice.
Yeah.
It's awesome.
Yeah.
Yeah. Speak a little bit more to the lack of research about women's healthcare just in general. And when I say speak more to it, I mean, I guess just kind of confirming there is such a lack of research, right?
Yeah, I
They're
remember, like,
really
go ahead, go ahead.
Oh, there's such a lack of research about women's health just in general. And it wasn't even until fairly recently that it was part of the regulations that women had to be included in medical studies. Like now it's required and it wasn't always. And so many of the norms that we have about health are based on men. Like recently, I learned that the sleep studies that said we need 7 to 8 hours of sleep a night are based on men, and women actually need closer to 9 hours of sleep a night. So all these years, we've been like, yes, we all need 7 to 8 hours of sleep a night. That's what we should be. No, that is only true if you have a penis. And even like it wasn't until 2005 that we understood the whole anatomy of the clitoris. Okay, that was 19 years ago. Like we have been to the moon, and only 19 years ago did we understand the full anatomy of the clitoris.
Yeah.
Even then, we've been told there are 8,000 nerve endings in the clitoris. But guess what? That was based on animal studies of animal clitorises. Human females actually have 10,000 nerve endings
Mhm.
in their clitorises. And to speak a little bit to like the menopause issue in particular, there are only 1 in 5 OBGYN residents state that they feel competent to talk about or help a woman in menopause. So
Wow.
80% said they do not. So
Wow.
4/5 of our doctors don't feel competent to help a woman or person assigned female at birth with menopause. And only 30% of US residency programs offer formal menopause curriculum. So even, and if you think about it, like all of the doctor people need to know about it, because if I'm 40 and I go to the doctor and I'm like, my joints hurt, my eyes are dry, I got itchy ears, the doctor needs to be able to say, oh, like, is this person experiencing perimenopause? And so even like a rheumatologist needs to know about it. Like every flavor of doctor needs to know, because we might go with some symptom that's related to perimenopause, and if they don't know that's a possible symptom, they're not going to pick it up and be able to help us.
Mm, okay.
Yeah.
Is an OB-GYN the best person to go to if you think you're experiencing perimenopause? Or I guess who would be the best like medical professionals for someone
Yeah,
to go to?
OB-GYN or urologist would
Okay.
be too. And but even then, because we know they didn't all get educated about it, you need to ask, like, do you have training in working with women with perimenopause? And a lot of people have access to professionals in their community that are experts in that, or like totally a good idea to ask, like in Facebook groups that you're in, like for your town, or if you're in a mom's group or like whatever Facebook groups you're in, ask like, hey, does anybody have someone that they see for perimenopause symptoms?
Mhm.
And get information that way, or ask a sex therapist if they have any connections with, or if they know of any OBGYNs or urologists.
Okay.
Sex therapists are great people to talk to if you're experiencing perimenopause. Pelvic floor physical therapists can be that's something I didn't even know existed 10 years ago. They can be extremely helpful, and they also will know other things.
Mhm.
So if you go because you have a tight pelvic floor, they also might help you discover some other issues. And then you might, oh, like maybe this is perimenopause. Let me look into this.
Yeah. Okay. Awesome. That's really good advice. Cause yeah, some you might get that question and it's good to just know, right, who you would recommend.
Well, and because we don't have information about it, like if you tell a 40-year-old woman who's experiencing some of these symptoms, maybe it's because we would use the word menopause because we all use that word incorrectly, but maybe it's, well, no, I'm not in menopause. Or a lot of times women will say like, well, my doctor checked my hormones and I'm not in menopause. And that makes me nuts, because perimenopause lasts a long time
Mhm.
and hormones fluctuate. And if you have some of these, if you are having hot flashes and some of these other symptoms, it is perimenopause.
Yeah.
So I think that's where like their education sometimes can be lacking. And that makes women feel even crazier. Like, well, it's not perimenopause, then what is it?
Yeah, because it must be something else then, is
Right.
what you would think.
Right.
Okay.
Yes.
So another thing, when I was doing the quick research about perimenopause or menopause, one of the things that came up a lot was HRT, which I guess is hormone replacement therapy. Is that something that you suggest women look into, or is that something that you like, no, we don't, I mean, only natural remedies needed, or what? I guess, yeah.
Well, I mean, I think it depends on the person. I think there's no reason not to research it, not research it because you're not conducting research, but read about it for
Mhm.
yourself.
Mhm.
Look at what current studies say and talk to your doctor about it to decide if it's right for you. Like, I can't give medical advice. And
Okay.
also, I think if you're experiencing a lot of really intense symptoms, why would you not give yourself something to help yourself feel better?
Mhm.
That's fair.
Yeah,
That's
if it's
another,
available to you.
yeah, that's another thing. It's interesting you say that, going back a little bit to like, you know, like Instagram fake doctors, like vitamins or whatever. Like I've seen pages out there that really promote the only organic natural remedies for the treatment of, you know, all this stuff. And I have a real problem with that. I mean, I think everyone had, if that's what you want to choose, fine. Like I think everyone has the autonomy to choose. But that's not going to be the right answer for a lot of people, and the way it's promoted is very, like, anti-medication. It's like, "That's so harmful. You should just be doing, like, these herbs instead."
Yes.
I'm like, "That doesn't make any
Well,
sense."
one thing I think also that's really important is we need to be looking at what the American College of Obstetrics and Gynecology like says are the best courses of treatment.
Mhm.
And because also like with testosterone, a lot of people a lot of women are using testosterone even earlier than menopause. And that's really not what ACOG says. ACOG says it's sometimes helpful for women in menopause, but we need to screen for depression and relationship issues and anxiety. And so we don't just want to be like testosterone for everyone because that has ramifications, right? And so looking at for yourself, what do the medical associations say is the standard course of treatment and doing that. And a lot of women use bioidentical hormones and those are created by compounding pharmacies and they are largely not regulated. So that's
Mhm.
another area, like, it sounds good, right? Like, bioidentical, it's made for me, but it also might not like, I really would caution people about that. I'm not saying don't do it. I'm not a doctor. I'm not giving medical advice, but really you gotta do your homework about that and learn about how they're made, what is the science behind it, like, really the science behind it, and, same with vitamins and things like that. Like, vitamins aren't regulated.
I'm glad that ACOG recognizes you should be screening for things like depression, anxiety, relationship distress, because I've seen people that, okay, I have a low libido. I'm going to take testosterone for it. That's the first line of like, this is the solution for it. And sometimes that works for some people. Like, and again, just like you, I can never tell anyone what to do.
Right.
But if you have, like, as an example, if you have a relationship where like sex is coerced all the time, let's say, I've also seen people leave toxic relation, like they're in a relationship, they have low libido, but it's just an unhealthy relationship.
Yeah.
I've seen people leave that relationship, move on to a healthy relationship, have zero issues with libido, and they didn't need testosterone or anything. They just needed to get out of this environment that was
Tough.
not good for their mental
Yeah.
health. And, you know, so just like as an example, so you know, like as a sex therapist, I mean, those are things we're always screening for. And I guess I never view it as me screening for anything. I think it's just natural questions that you ask, you know,
Yeah.
like what is the situation you're really in? And I've definitely seen people go on and go, yeah, I don't think my libido is actually that low. I think I
Right?
was just in this terrible situation.
Well, and we
Yeah.
kind of like right now, testosterone, I feel like is just glorified so much.
Yeah.
And what isn't talked about is because I've seen people who are using testosterone because it's prescribed to
Mhm.
them. And it can create like more anger issues. And it can also create like make you like make your hair thin and things like that. So we aren't talking about what are the side effects of taking this testosterone is also something I just feel like we don't consider that as much.
Yeah.
So because I like to go the expert websites too. I've never heard of ACOG before. So what was that acronym again?
It's American College of Obstetrics and Gynecology.
So this is like pretty much the board of
Yes.
gynecologists that are okay. That's good.
Yes.
That's good info to know
And
for
a lot
like
of
that.
research
Yes.
comes from them. And yeah. Yeah.
Yeah. Well,
Perfect.
and also they're going, like, if they're like validating research, right? So if you look at what if they're publishing a study, or if they're saying like this study is legitimate, then that's something to pay attention to, right? Because
Mhm.
I think this is another thing in grad school. I really learned how to be more suspicious about research. And because we can make something very official sounding like we did research on XYZ, and
And then
it
you look at how many, it's like, well, we tested these 100 people. Like the pool could be so small, and you're kind of like, does that really
right.
represent like the general population? Yeah, research doesn't always mean that it's 100% representative of like what could be
Yeah.
going on.
And
Yeah.
always go to the very end, because they have to say what their conflicts of interest are. And that's where you can be like, oh, this drug is a Pfizer drug and we studied it, and who paid for the study is Pfizer. Okay, well, then that's something
Yeah.
that you want to know. Not to pick on Pfizer, but that's just a random name I threw out there.
Yeah. Yeah. Skipping to the end is definitely how I read most of my research, because the research articles are
Very
really
dry.
involved and hard to get through, but you can get a lot through like the beginning, what their purpose is, and then what they concluded, and then yeah, and then at the
Yeah.
end. So
Yeah.
yeah.
Okay, so I have a couple before because we're running a little low on time, but yeah, as far as like the myths, I have a couple myths that I pulled up from the internet, and I want to know if like you agree with them or if those are things that you can, I guess, kind of not true, I guess if is what I'm saying. So I'm gonna
Sure.
give you a rapid fire, Brandy. All right. So the first one is loss of sexual desire is inevitable. That's just part of menopause or perimenopause.
False.
Okay. Okay.
Myth.
Um, vaginal dryness can't be treated. I think we discussed that already
That's a myth.
today. Menopause affects all women the same way. So,
Also false. I
okay.
mean, ultimately, the one effect that would be universal is the cessation of menstruation.
Okay.
Mhm.
So most of us eventually will stop menstruating and be in menopause. So that is a pretty universal. But the other things, like I said, some women experience like very little difficulty, just stop menstruating and go on with their lives.
No hot flashes, no nothing. Like
No
some
hot
people,
flashes, no
oh,
nothing.
it's nice. Listen, hopefully. Okay.
Well, also to speak to that just for a second, ask your mom, your aunts, your grandmas what their menopause was like, because just like with like onset of menstruation and other like pregnancies and things like that, it's not 100% hereditary what happens, but it we can have a lot of similarities with the women that we are related to. So this is another reason why we need to be talking about this, because most people have no information about their grandmas or moms.
No one in my
Menopause.
family, no one in my family has ever talked about it.
Same. Well, same. Yeah.
There's not one woman in my family who I've ever heard ever talk, and I've never asked. So now I'm inclined to ask.
Yeah.
Yeah.
I mean, I noticed when my mom kind of just mentioned that she was getting hot flashes and things like that. So I kind of, but as far if you're talking about, well, we're going to grandma's, no way in hell would my grandma ever have mentioned that.
Yeah,
Okay.
okay.
No, good to know.
Yeah.
All right. Next one. Only women experience sexual changes during menopause.
Well, men wouldn't have menopause, but men definitely can have hormonal fluctuations and experience sexual changes as well. But we wouldn't call that menopause because they're not menstruating, so they can't cease menstruating. But it's normal to have hormonal fluctuations as we age.
Do they have like a term for it at all, or is just
Actually, don't
fluctuation?
know. Do you know, Lindsay?
I don't know either. And now I'm curious, like what would be the equivalent? Because men have changes as they get older too,
Sure.
but I don't know what we would call that.
I
Hmm,
don't either.
interesting. Okay. And then sex after menopause is always painful.
No. And if it is, please get help, use lubrication, don't do that activity. definitely don't be having painful sex. Period. End of story. The end.
Preach. Yes.
Yes.
Yes. We don't, do not do that.
Okay.
It's not going to, like, if you grit your teeth and bear it 5 times, it's not going to get in. It's not going to be any better that 6th time. It's probably just going to get worse because you might get vulvodynia and your vagina might be like, nothing is coming in here, and it will just make it worse. So, and also
And
anybody who's giving that bad advice of like, just have 2 glasses of wine or whatever. No, we don't do that either. No.
Okay.
well, and the more you just push through it, God, speaking of like quote unquote low libido, you're going to want to do it less and less and less. If it hurts every time, at what point would you ever be like, that sounds like a fun activity. I think I'd
Right?
like to do that. Like, it's never going to be like that. It's going to be like, oh shit,
Yeah.
gotta do it again. Ugh.
Yeah.
It's awful sexually, physically, but also mentally too. It's just
Yes.
terrible.
Yeah.
The
Denise, can you tell we feel very strongly about this?
Yeah.
Yeah, I know. I could go on and on all day about it, especially when I see clients. I'm like, oh no, don't do that. Don't do that. It's terrible.
I love it.
My last question for you is just speak to our audience about the importance of community, because I imagine if someone is going through perimenopause or they hit menopause, I would imagine it could feel lonely. If you
Yes.
if you feel like you're going through it alone, that could be it could really make it worse.
Yes, because you really are just going to think you're crazy, and maybe you aren't going to have all the information about what these symptoms are. And so talking to your good friends about it, and talking to your mom and your aunts, and if your grandmas are still alive, talking to them about it, and just normalizing that we talk about menopause and perimenopause, and we talk about these symptoms. And if you don't have any of those people to talk to about it, then seek out a therapist who knows about menopause and symptoms of menopause that you can talk to about it, because we have to start creating more community and talking about it. Like when I was 37 and all of my friends were about the same age, none of us knew about menopause. And it was lonely. I mean, it was double lonely because I was also doing cancer treatment. But when I was like 40, I tried to teach a class at the yoga studio about this, and not one person signed up. And I was like, you all are going to be, I was thinking, you're all going to be very sad that you are not taking my class, because you're going to feel like you got hit by a truck and you're not going to know why. And now I see on socials all the time my friends talking about menopause and like, oh my God, this is really hard and I don't have information. And so we just need to be talking about it.
Yeah, absolutely.
I mean, it's one of those trigger words that like you hear it and like nobody really wants to hear about it at all. It's like
Yeah.
maybe a reminder that you're getting older. I'm not sure why, but it's just, I guess it's a trigger word for some people.
But it also is like, how great is it that we get to have a time where we change so much that I think it's why people always say, like, once you turn 50, you don't give a shit what people say about you. I think it's not turning 50. I think it's menopause. I think it's like, oh, this time is for me and I'm going to do what I want. And not in a selfish way where you're like being mean to people, but just like you're not going to constantly be putting other people first and sacrificing your whole life for other people if that's what you've been doing. And I think
Yeah.
that is amazing. Like to get a little gumption to choose yourself. And I mean, I think that's awesome. So it is not the decline of life, it is the decline of your hormones. And then once that stops, you can live happily.
That's awesome.
Yeah.
Okay, so I loved, the idea of getting sex therapy or going that route, but for the people who maybe sex therapy isn't their means on how to, like, they don't have the means to get a sex therapist, do you have any books, podcasts, any like free pamphlets out there that we can share with our audience that will give them a little bit more information but at an affordable price?
Yeah, so that book, What Fresh Hell Is This by Heather
Okay.
Corinna, I definitely recommend. There is actually a podcast that I just listened to a couple weeks ago. I love this podcast, but this particular episode of Betwixt the Sheets, episode 215, is about the history of menopause. I found it really fascinating.
Awesome.
Also, that podcast is just incredible anyway. It's like combines history and sex, two of my favorite things. Dr. Rachel Rubin on Instagram is a great person to follow. She has a ton of stuff in her link tree, tons and tons of resources that are all free. So
Awesome. All right, Lyndsey, do you have anything before I do my closer question?
I don't think so.
Awesome. All right. So I'll give you my spiel, Miss Brandie. This is a sex positive podcast, right? So one
Woohoo.
thing that we have learned in the sex positive movement, or actually the three big things that I've learned in the sex positive movement is A, consent is key. It's the most important thing as far as anything goes. Consent, consent, consent. B, sex positive movement is very inclusive. We try to include all types of diversity, cultures, body types, relationship status, like just everybody is welcome. And the third most important thing I've learned about the sex positive movement is the thinking that we need to be teaching comprehensive sex education, right? Like that's, to me, that's so important, hence the YouTube channel, right? So I'm curious what your sex education was, and I want to know both at home, like with your parents, like how did they have that sex talk with you? And then two, your formal sexual education in school, if you had one.
So I don't recall my parents having a sex talk with me. I think what they said was, if you have any questions, let us know. I already knew how babies were made because when I was 6 years old, I got a book from the library and it was about how babies were made, but also I didn't know the word penis. And so when I read the word penis, I thought it was pennies. So for like 2 years, I thought, seriously, swear to God, I thought women got pregnant by putting pennies in their vaginas.
Wow.
Yeah. So that was the first thing I learned about sex that I can recall.
I
As
mean,
far as
kudos to you for 6 years old and checking a book out for about that.
right, I
Wow,
wanted that
yeah.
information. I was very curious.
Hey.
As far as in school, what I remember, so I was in high school in the 80s and it was like late-ish 80s. And so it was definitely the time of like the AIDS epidemic. And so it was very like, do not have sex, you'll get AIDS. Here are pictures of chancres from herpes. Like, it was not positive at all. Like, there was nothing positive about it. I don't recall what we got told about birth control, if anything. It was Texas. I don't know if we were at abstinence only yet or not, but I just remember it was very like, lots of warnings about the dangers of sex and how sick you get from it. Of course, no one was saying like, sex is great, that's why people do it, and here's how to be safe while you do it, which would have been lovely, but that's not what I got.
Was it in high school the first time you had any type of sexual education course?
I mean, I remember in middle school learning about reproduction, like plant reproduction and stuff like that. And we did have, oh, in 8th grade, we had a making a baby lab because that was about genetics. So I don't know if this would happen now, but every girl was partnered with a boy and we would like flip coins and like figure out all these genetic things. And there was a lot of laughing on making a baby lab day because that's a pretty funny thing to name it for middle schoolers. But I think it was probably like high school health, maybe when I learned that. I don't know. It was the only class I ever had with my best friend, and we talked to the whole class. So hard to say.
Fair. Yeah,
Okay.
that tracks. It's pretty much our education still in the Texas system, at least, is you get reproductive education early on, middle school-ish, maybe sometimes elementary, and then after that, it kind of still stays reproductive a little bit, but it's mostly just abstain.
It's
And
fear-based. Like, here's all the negative
Yeah.
consequences, so just don't do it. And that clearly doesn't work. Yeah.
yeah.
Also, you're not getting taught about menopause,
Nope.
which also needs to be taught in high school. Also,
I agree.
That's part of it being comprehensive. Yeah, I agree totally.
Yep. Yep.
Yeah.
Well, thanks so much, Brandie, for
Yeah.
answering all of our questions and providing us with so
Sure.
much knowledge. Before we wrap up, I just want to give you a moment to promote yourself. Like, let our listeners know where they can find you on social media. By the way, anything you share, like website, whatever, we'll include it in the episode description. So anyone who's listening, we'll have those links where you can find Brandie, but go ahead and share just anything you want to promote about yourself.
Sure. People can find me at sellerscounseling.com. And I'm on Instagram. It's brandie.sellers, and Brandie is Brandie.
Wonderful. Well, again, we're so glad to have you on. And for anyone listening, please let us know what you thought about this, what new things you learned, what questions you might have, as well as any topics you might want us to cover in the future. We are open for listener support. And so for anyone that does like to tune into our show, if you'd like to support us to help us continue producing quality content and to continue our show, you can support us for as little as $1 a month. And we have a link for listener support in our show description where you can find and sign up if you would like to do so. But yeah, Denise, anything you want to add?
No, this was great. Thank you so much. You definitely schooled someone who is probably going to be looking at that in general in the next couple of years. So it was really awesome.
Thanks for having me.
Yeah.
Of course. All right, everyone. Well, thanks again for tuning in. We are Sex Positivity Unfiltered, and remember to stay curious and fuck politeness.